Diabetes. It is some sort of a permanent disease and something that is related to the sugar in our body. We all know that about diabetes. But do you know what exactly it is and how it affects the body? Let's tell you that in a simple way which is easy to understand. Diabetes is the most common lifestyle disorder which affects the endocrine or the hormone system of the body. The blood sugar levels in this disorder stay more than normal on a consistent level. It can happen to anyone, and in today's world, at any age. All over the world, it currently affects more than 380 million people. The World Health Organization or the WHO predicts that by 2030, that number could double. Insulin is a common word that is associated with diabetes. It is very important to understand what insulin does for us to understand diabetes. Insulin is the hormone produced by the pancreas which allows glucose to enter the body's cells. When we eat, the body turns food into sugars or glucose. At that point, the pancreas are supposed to release insulin. Imagine insulin as a key which opens the cells and allows the glucose to enter and be used as energy. The glucose is needed by our body as it is used as fuel for energy. It is important for us to perform our normal bodily functions which are vital for living. But with diabetes, this system stops working. Glucose comes from digesting carbohydrates or carbs as they are popularly known, as well as is produced by the liver. When someone suffers from diabetes, then the body cannot make proper use of this glucose. It starts building up in the blood. The fuel supply for energy also becomes low. Simply speaking, diabetes is a condition when the amount of glucose in the blood is too high because the body cannot process it properly. It can happen because the pancreas do not produce any insulin at all or are not producing enough insulin. When there is a shortage in insulin supply or when the insulin that is produced does not work properly to process glucose, it leads to diabetes. Diabetes is also known as diabetes mellitus and is of three types, one type being the most common. These three types are diabetes type 1 or juvenile diabetes, diabetes type 2 which is the most common, and diabetes type 3 or gestational diabetes. There is also pre-diabetes when the blood sugar levels are high consistently but not enough for it to be termed as diabetes. Care needs to be taken at that stage itself, otherwise it can develop into diabetes. So now, let's explain the different types of diabetes as well as what happens when someone suffers from them.